So I will share with you what I thought about cracking of the nucleus. So when I started doing various nuclear cracks, I came across. I have went through this journey for a quite long time, and then I realized that uh, these are the 4 points which are important when you go for a cracking. This is three-dimensional thinking, understanding the lamellar structure. There's a Y component, and there is lateral separation. These are the 4 factors which are responsible to achieve a crack. Now this is published, courtesy Dr. Abhijat, who's having a great writing skill. I have been showing this for now more than 1.5 decades, but now this has been published. The purpose of developing a nucleotomy technique is to make it predictable, reproducible, so that everybody can produce a crack every time in every hand in every type of cataract. So like I am a two-port phacosurgeon, so I make 2 ports. One is the main port, one is the side port, and I know that when I will work, a crack will come in between. So that's the three-dimensional thinking. You should imagine that what you're going to do and what you're going to achieve. And if this simple process is clear, then you will be able to get a crack. This photograph has attracted my attention. These are the pre-existing lines on which a crack will develop. So if you know, these are the lines, this is the lamellar pattern, this will help you achieve a crack. This is the photograph taken from the eye of a pathologist's point of view. And what we see is that the lamellar pattern is persisting even in hard cataracts. And these are the hydration lines. Water moves on the line of path of least resistance. Water is moving, and these are the zones on which we will be developing cracks. So there are so many phaco tips which will achieve a crack. So that means any tip would achieve a crack. There are so many techniques which will achieve a crack. That means any technique would achieve a crack. There are so many machines which have been able to achieve a crack. That means any machine would be good enough to achieve a crack. There are so many choppers which have achieved crack. That means anybody could have achieved crack. We have proponents of very sharp choppers, and we are proponents of using Sinskey hook. So that means the trick is somewhere else. It's not in the machine, it's not in your chopper, it's not even in your technique, but something else. So I went to understand what is the crack mechanics. And these are 3 types of cracks which have been described in literature. And this is the mode 3 crack, which is very similar to our lateral separation. So that is the simulation. Another thing which I understood was, I discussed with my physics friends, and they were not able to actually answer what is the decomposition of a vector, of a circular vector. Because when we are rotating, a circular force is involved. And what I came to know that these are the forces, like there's a tangential force, there's a centripetal force, there's a centrifugal force. And ultimately, if you decompensate these vectors, we get a posterior vector overall. And the torque is always 90 degrees to the rotation. So if we rotate it like this, the force will go like this. So what I thought, that if we pronate and produce a circular movement, the crack should go deeper. And I will share this 2 minutes video if it works. So the purpose of showing this part of the video is, when I started doing cracks in the beginning of my career, then we were able to produce a crack. Give it a name of your choice, a horizontal, vertical, whatever. But the point which I want you to notice is that the amount of tangential pressure is tangential pressure on the zonules is very high. You are pulling down a lot. So that was the point which I wanted to make in this section of the video. Pre-existing lines. Now, cracks are produced on pre-existing lines. Can you increase the audio a bit? So here what we are doing is, okay, leave it. We are pronating our hand while doing a crack, and the crack goes deeper.
If you do only lateral separation, then the stretch produced will be much larger. So you embed, you engage, and while doing lateral separation, you pronate.
So when we are doing lateral separation, we are actually pronating.
And how do you know that you are pronating? You just watch the aspiration port of the phaco. So embed, engage, separate and pronate. The crack goes deeper with much less strain. Embed, engage, separate and pronate. Embed, engage, separate and pronate, the crack goes deeper. If you don't pronate, then the stretch required for doing the completion of your lateral separation of crack will be much more. So that's the beauty of this concept. You pronate, your crack goes deeper.
Yeah, that's the basic point which I wanted to make, that if you pronate, the crack goes deeper. That's the basic concept. And when I saw some very good surgeons doing live surgeries and showing the demonstration of videos, I realized that while they are doing crack, actually they are doing something like this, unknowingly. So that's what happens. As you practice more, your tangential pressure goes down, and unknowingly you are doing some rotation. So if you make rotation into part of your practice, you will be able to do crack, especially when your vision is not clear, your pupil is not dilated, and you're working on basic principles of crack. Then understanding this crack mechanism is of crucial importance. In a normal case, it's not, you can achieve crack. But when the pupil is mid-dilated, media is not clear, you're not sure about where you're operating, you just go follow the basic principles, embed, engage, separate and pronate, and the crack, you will be able to achieve the crack. That's the importance of this. Thank you very much.